Chris Archer-Chico is the nurse coordinator of the Pulmonary Vascular Disease Program at Penn Presbyterian Medical Center in Philadelphia, Pennsylvania. She's been caring for pulmonary hypertension patients for more than 21 years. Fran is the nurse practitioner and clinical coordinator at the Temple University Hospital Pulmonary Hypertension and Right Heart Failure Program. She has been working exclusively in PH for the last 8 years. With that, welcome Fran and Chris, and thanks so much for taking the time to be here with us today.
Thank you for having us.
Yes, thank you so much. So this is Fran, and I just wanted to go over our session description. So what we hope to cover on women's health issues was specific considerations to women with PH. So the areas we will discuss include psychological impact of a PH diagnosis, routine health care for women, methods of pregnancy prevention, pregnancy risks, coping strategies, changing relationships and changing body image, and emotional and sexual intimacy in the face of a medical diagnosis. We have some other things we're going to throw in there too, but that's basically what we would like to cover. So to get started, I just wanted to talk a little bit about the impact of a PH diagnosis in younger women. And I'd like to talk a little bit about self-image, some realistic expectations, acceptance, finding new ways to participate in activities, and then talk a little bit about romantic activities. So in young women, and I think in all of us, we certainly have a sense of our self-image. And if that image changes because of a new medical diagnosis, that's a little bit hard to take. Whether you're taking oral medications or specifically if you are requiring pump-based therapy or inhaled therapy, that becomes a part of your life 24/7, 365. So you have to just kind of come to terms eventually with the fact that that what you're taking is life-sustaining for you and will make you feel better, stronger, and able to do the things that you want to do at your young age. So again, you have to incorporate the people that are supportive to you so that they know how you're feeling, and also be comfortable eventually with what you have to have in order to feel better and do well with your PH diagnosis. So some realistic expectations, I think, are to allow yourself the ability to take maybe one step forward and 2 steps back. This is not something that everybody in this country has to deal with, as you know. This is not a common diagnosis, but allow yourself the time to get to a point where you feel comfortable with who you are and what you have to deal with going forward. And don't beat yourself on the breast because it's a hard thing for you to do, and A doesn't always lead to B. And then hopefully you'll get to the point where you accept what it is you have to deal with going forward, knowing that, thank God, as we progress with this disease process, always new therapies are coming into the forefront. So many have been available to patients just within the last 5 to 10 years, even since I started in PH. And there's always some new things on the horizon that may be better for you as time goes by. But the important thing is that you accept what it is you have to take in order to get through your daily activities. Finding new ways to participate in activities. I'll use one of my patients as an example. She's on a pump-based therapy and has been for many years. But she's gotten to the point where she doesn't let it rule her life anymore. And initially it was a little bit overwhelming for her and her family members, but she has good support at home. But then she also realized, what can I do as a young woman to just get on with my life? She loves to travel, and it was something she wanted to continue to do. So since she's on a subcutaneous 24/7 infusion, she learned to not schedule her travels in the first 5 to 7 days after she would change her subcutaneous remodulin site, because she knew that was when she might have the most discomfort as the new site kind of settled in. And that became her mantra. Her and her husband travel, but they don't do it under those circumstances. She always stays at home. Also, if finding ways to participate in activities by keeping your pump with you, getting new way, kind of coming up with new ways to carry your pump. Almost every woman now, or a lot of women, have purses that are really like backpacks, so nobody really knows that you have one. Also, when patients wear oxygen, they can use OxyView, which would bring their oxygen through their glasses, and you don't even have to wear glasses. You could just get window panes. And then the O2 would go through the glasses right around the site and into your nose. And if I'm looking at you from across the room, I can't even tell that you're wearing oxygen. So there's ways to just kind of find out, and again, PHA is a great way to help you find out those things, and certainly support groups, so that you can do the things that you want to do. Romantic activities, that opens a whole new can of worms for people, both of all age groups that have been diagnosed with PH. I think, important thing to do is to share your feelings and concerns with your partner once you're comfortable doing that, so that they know what to expect from you, and they also know what not to expect from you. Also, I think when I was thinking about this, I thought there's kind of 3 Ps, the letter P, to kind of think about making sure that you're ready to engage in romantic activities. And certainly I think one is prepare. Take the time to know what it is you need to do to be comfortable having a romantic relationship. Take time out of the day or night to know what you need, and also what is the best time for you. If you're most tired in the evening, maybe that's not a good time for you to engage in romantic activities. I think the next P is pace yourself. Learn what you need to do to get through a romantic activity that is satisfying for you, and if that means going slowly and taking time to just maybe enjoy foreplay, then by all means give that a try. And also, I think the last one is participate. You want to be able to be an active participant in your romantic activities. So again, the whole prepare yourself and pace yourself will help you participate in the best way that you can, so that it's enjoyable and satisfying for you. I think too, if you can come up with a safe word that both you and your partner know, so that you can say that word if you find that, okay, this is just getting a little too much for me to tolerate. And you could continue what you're doing and just kind of, you say that safe word, and then you both know to just back off a little bit. Also, the benefits of working with a multidisciplinary team can't be said enough. Your primary medical team, for adolescents, certainly there are medical specialists that can help with prepubescence and certainly getting through the teenage years. I do not care for children or teenagers. I am in an adult program, so I can't speak to that specifically, but there are certainly those type of specialists available. Certainly OBGYN, your obstetric and gynecology physician or nurse practitioner should certainly be a part of you maintaining your health care, just as in wellness in PH. And then certainly the importance of family planning, which cannot be stressed enough in pulmonary hypertension. And then I'm going to turn this over now to Chris, because she has some great information for you regarding family planning.
So I'm going to speak a little bit about family planning, pregnancy prevention, and talk about what happens when a woman gets pregnant and how, especially in a PH patient, there's a lot of strain on the heart. So first, pregnancy is not recommended for women with pulmonary hypertension. I realize that that's devastating, and I think women do have to grieve and come to accept that family planning is going to be maybe different than what you dreamed about as a child and teenager. I think it's really important that you speak with your partner and have an open and honest conversation about how you're feeling, and give your partner time to express how they're feeling. Because like you, they also are going to need some time to grieve and come to acceptance that the family that you expected to have may not be traditional, again, as what you had thought about when you were growing up. And most importantly, I want you to realize there is a lot of support for you, your PH nurses and physicians. The PHA has wonderful resources on their website, There are local community groups, and now that we have the internet and we're so connected with each other, there are groups out there for couples who struggle because they can't have biologic children, and I think that may be helpful for many. So it's very important, and we do a lot of counseling to help patients avoid pregnancy. I'm not going to go through each of these distinctly, but there are permanent ways, there are non-permanent and reversible methods. And I do want to speak a little bit about the hormonal methods to remind you that for patients who are using an oral estrogen, progesterone tablets, and again, those hormonal preparations, for those of you on endothelin receptor antagonists, the effectiveness of the pregnancy prevention will be reduced. And so we have counseled our patients that they also need to remember to use a barrier method. So you need 2 forms to prevent pregnancy. Another thing is we are really not sure about the role of estrogen in the development of pulmonary hypertension. So before you get started on this type of medication, we would recommend that you speak with your PH physician about what they are counseling their patients. Sometimes we recommend that they use the lowest dose that would be of estrogen that would be protective. And then lastly, using oral birth control pills, patients can develop DVTs or blood clots in their legs. Now, for those who are on anticoagulation, they're pretty much protected. But again, your choice of pregnancy prevention should be discussed with your PH team to make sure that it's adequate and that you have all the information that you need. Now, moving over to pregnancy issues in women with PH. Again, this is a very individualized decision that should be made by the PH patient and husband or partner, and speaking with the PH physician. You need to know that pregnancy has many risks for women with PH, and the maternal mortality, meaning the potential death of the woman, is up to 30 to 50% in the literature. So this decision is very critical, that if you become pregnant, that if you would continue that pregnancy. And it's not only such a serious risk to the woman, but it's also risks to the baby. So normal changes that happen during a pregnancy and delivery. During a pregnancy, a woman increases her blood volume by 50%, and her cardiac output, or the blood flow through the heart, increases by 35%. So these changes cause an increased heart rate and increased blood flow through the heart. Typically by the second trimester, which is about 4 or 5 months in, this increased workload on a woman with pulmonary hypertension, it can really cause actually symptoms of right heart failure, as that right heart becomes more overloaded. And then if the woman moves more through the pregnancy into delivery, there are many rapid fluid and hormonal changes, which again cause further strain on the right heart and can also then result in actual cardiovascular collapse. So again, a very serious situation. And this increased workload occurs at the heart not only just at the time of delivery, but following the delivery. And actually the risk of death of the woman is highest at the time of delivery and the first several days or first few weeks after delivery. And we're talking serious potential complications, including a pulmonary embolism and arrhythmias and stroke. And these are really serious things that can happen to the woman. Now, managing a patient through a pregnancy is really a very complicated situation. There is just no simple way about it. A patient who becomes pregnant with pulmonary hypertension right off the get-go is considered high risk. And we really get them a full team, and it's not just the PH team, but they need high-risk OB/GYN physicians and nurses. They need anesthesia, and then we need someone to care for the baby, neonatologists and maybe even a neonatal intensive care nurses. So patients who are thinking they're going to go through a pregnancy need to know that they're going to require frequent office visits and many diagnostic studies to watch over both them and the baby. And again, it's not just the echoes that we get in our office, but it's going to be all the diagnostic studies that the OB physicians and nurses need, again, to watch over both the baby and the mother. Pregnant PH patients should expect that they're going to be admitted early and likely as soon as it's felt safe that the baby can be delivered. So they will, again, be admitted for continuous and ongoing monitoring. And again, there is no standard protocol to manage, but the endothelin receptor antagonists, of course, are contraindicated due to the risk of fetal defects. So those would have been stopped at the time of finding out that the patient is pregnant. Medications that are used are the phosphodiesterase E5 inhibitors, and then typically just before delivery, the patient would need an IV prostanoid therapy to help get them through the time of delivery. So, summary of the pregnancy issues is that pregnancy puts a significant strain on the PH patient, and frequently they have a cardiovascular system that is not able to meet those metabolic demands. So this imbalance can really cause worsening pulmonary hypertension, very serious complications, and even possibly death. And I don't want to forget about this little baby. The baby can have an increased risk of premature birth and then therefore also the small fetal growth, small birth weight. The risk of stillbirth and neonatal death is elevated at 7 to 13%. And the seriousness of all of this, the PHA Scientific Leadership Council has put out a consensus statement on birth control and hormonal therapy, and in there it does say that they are really advising patients to get pregnant if you have pulmonary hypertension. Now, while all of that sounds very sad, there are other ways, and I think you need to be creative about how to get children into your life. There is adoption, and I think PHA has resources to help people and link people up towards that. There's also, again, many resources on the internet. You can have consideration to having foster children or even surrogate mother to carry the baby. So again, there are ways that you can involve children. And when we originally presented this material at the PHA on the road in July, a woman proudly stood up and shared with us that she and her partner had just adopted a baby the night and got the baby the night before the conference. So that was all like such excitement for us for her to share. She wanted to come specifically to our session to share that with us. So we were just thrilled for her. So Fran's going to go over now speaking about menopause a little bit for the older woman with pulmonary hypertension and addressing some of those issues.
Thanks, Chris. So we're moving from pregnancy right on to menopause. And as Chris mentioned, when we did PHA on the road in Philadelphia in July, this was kind of an interesting piece of the session. Patients said that they really liked some of the information that was presented. It's a general overview of what menopause is and perimenopause, but again, people found it helpful. So some of the basics. What is menopause? Menopause is actually very simply is the point in a woman's life when her menstrual period stops. And what happens is the ovaries stop producing hormones, estrogen and progesterone. So that's literally what it means. In the United States, the average age of menopause is about 51. Some women can have menopause as early as 40 or as late as 55. Some of the literature says that you can kind of make a judgment on when you will be going through menopause, comparing it to when your mom went through menopause. So it's just an important time in a woman's life to kind of take into consideration what can happen and what cannot happen. So some of the things that can happen are certainly irregular periods. Now, to go through menopause and complete menopause, you have to not have your period for 1 full year. So that's important to know because that really it is the true definition of menopause. But if you still can have some irregular periods in between if you're kind of in that transitional period or what they call perimenopause. Certainly hot flashes can be something that you may be experiencing, and there's a sudden feeling of heat, usually in the upper part or all of your body. Your face and neck can become red. You may get blotchy around your chest, your back, and your arms. Or you may have some heavy sweating and then cold shivering that can follow. So there's kind of a myriad of things that can happen. Trouble sleeping. You may find it hard to sleep through the night. You may get sweaty at night. And you may perspire while you sleep. Unfortunately, if that occurs, you may feel extra tired during the day. Mood changes are not uncommon either. You may have some crying spells. You may just feel it generally a little bit crabby. Or you can have just downright depression. And it can also come from stress at this time, family changes, or overall feeling tired. So, but remember, mood swings aren't the same as depression. Mood swings are usually something that come and go. Depression kind of sticks with you. So the advice here is if it's this constant feeling of depression and not having interest in the things you used to have interest in, is something you really need to talk to your family physician about. And then also feelings about sex may certainly change after menopause. Because what happens is you no longer have your period. So there's kind of a two-way street here that, you feel good about it because you can't get pregnant anymore. Or you don't feel really great about it because you don't have the interest that you used to have because there is a change certainly in a woman's libido. Okay, so I mentioned perimenopause. The other definition for it is menopausal transition. And just so you know, that's the time leading up to a woman's last period. And there's really no way to tell how long that will last. Some of the literature says it can last as long as 2 to 8 years, and that's a long time. But again, it's when your periods kind of stop and start again, but stop and start within that 1 year period. Also, you can become pregnant during this time. So I think that's a really important take-home message. If you have not gone through the official menopause and you're in the perimenopausal period, please remember that you can get pregnant. So some of these are kind of general points about how you keep yourself healthy during menopause. Certainly eat well and eat smart. Sometimes as women get older, they feel they may not need as many nutrients and they may need fewer calories. But the important thing is to eat a balanced diet. And you know yourself what you consider to be a balanced diet to keep you kind of your engine up and running. We certainly want you to eat. We recommend that you certainly still watch your sodium intake. Certainly don't take in more than 2 grams of sodium a day, or even in some extremes, we tell our patients that they should not take in more than 1,500 milligrams of sodium a day. Because we just know where salt goes, water goes, and the last thing we want you to do is develop water retention, and that would be something that we have to certainly treat. Be active. Exercise the best way you can. The best exercise, certainly for bone health as well, because you are putting pressure on your legs, is walking. If you can incorporate that and make that a part of your life to the best you can, the important thing is to move. And as that commercial on TV says, bodies in motion tend to stay in motion, and bodies at rest tend to stay at rest. So walking, if you make walking a part of your life, and it doesn't have to be on a treadmill, it can be outside when the weather's fine, or indoors from room to room. Most of my patients don't have a treadmill, so we recommend that they take a time during the day and walk from room to room, maybe for 10 minutes in the morning, 10 minutes in the afternoon, and then combine it to the point where they can be doing 20 minutes nonstop each day. Certainly we hope that you don't smoke, but if you are smoking, it's very important that you quit smoking. And again, smoking can hurt your general health in so many ways, but it also can damage your bones. We also want to stress that you should stay away from secondhand smoke. And if you feel that you are still smoking and you just can't break that habit, we certainly recommend that you get help to quit if you need it. Take care certainly of your gynecological health. You're going to need certain tests like a pelvic exam after menopause. Most women would need a Pap test every 3 years, but depending on your personal health history, you may need a Pap test more often. So please check with your primary care provider or your gynecologist. Certainly you would need mammograms and on a regular basis, and if you've had trouble with breast cysts or breast cancer, then that would change that for you. So follow the recommendation of your PCP or your gynecologist. You may have some urinary incontinence that comes along with some of the aging process as some of our muscles lose some of their strength. So if urinary incontinence is a problem for you, there are ways to address that are non-surgical. Some are surgical. So again, please discuss that with your gynecologist. And certainly immunizations and screenings are very important. So keeping your blood pressure in control, I know we check that all the time, as every PH program does, so we're very aware of that. Also, bone density tests should certainly be a part of your general health care as you get older. You may need vitamin B12. You may need certainly calcium. The recommendation for a woman after menopause, their calcium needs can go up to maintain both bone health. So usually for women 51 or older, should get about 1,200 milligrams of calcium each day. And vitamin D also is an important part of bone health, so you may be prescribed calcium with vitamin D as well. And we also kind of covered the screenings. And then I just wanted to mention some resources that are certainly you can use. Womenshealth.gov is a part of the provided for us by the government. It's the Department of Health and Human Services. It's excellent. It covers all women's issues throughout the lifespan. The American College of Obstetrics and Gynecology, and then of course PHA. Their website of the Living with PH /coping. There's several options under the coping section that you can address. One is a positive self-image, and then another one is maintaining healthy relationships. So we can certainly take some questions, but I did want to say we wanted to say thank you. We certainly wish you a happy and very healthy holiday, and the best to you and your family in 2016. And that's certainly from Chris and I know I speak for Allison as well.
Great. Well, thank you both so much for leading that discussion. We have started to receive a couple questions by chat, and participants are welcome to continue sending questions my way using the chat function on the bottom left. And if you prefer to ask your question aloud, you can click the raise hand button at the top of your screen, and we will call on you. So the first question that we've got is, could one of you speak about having a hysterectomy and being on estrogen replacement while being a PAH patient?
I can take that. This is Chris. I do think that sometimes women do need a little bit of estrogen replacement. I don't know exactly how long that is recommended for, but I think that that should be addressed, to your PH physician, and maybe you would be on it for a period of time, and then it could be weaned down and off. I know sometimes women have trouble with some vaginal dryness, and so sometimes that can be handled with some, like a little bit of estrogen cream or some lubricants to help with that dryness problem.
Great, thank you. Our next question is, how early in a relationship would you recommend that a PH patient talk to their potential partner about their disease and the change in their life?
Okay, so I'll try to address that, and Chris, jump in if you have anything to answer. That's a hard one. I think it's very, very individually based. I think you have to come to terms with it yourself, and then be able to describe it and how you feel and what you're able to do and not do to your partner. So I think, I guess as early as you can, but also as comfortably as you can, because you want to maintain that relationship with your significant other as best you can in all aspects, because boy, do you need that person in your life, just to get through the everyday kind of stuff, but also to have that romantic relationship that kind of carries us through, even if it's just to be held by somebody. But I think it's very individual, and I think you have to decide how early you can do it. I think the earlier the better, but it has to be comfortable for you. You have to understand your disease process, be able to explain it to your partner, and let them know what makes you feel good, what makes you not feel good, and then you can, then they know what to expect from you as well. What would you say, Chris?
I think I agree with what you said. I don't know if this is a new relationship. I think I would start really simple, kind of test the waters a little bit. And, you decide, is this someone that perhaps you want to be committed to for the rest of your life? And, if it's heading towards that way, then I think you need to sit down and, start to expand a little bit more on, your health issues, maybe, start to take them to the doctor with you, let them know, what your medications are and things like that. So I think as you become more involved and committed with a patient or with a partner, then I would start to really divulge more. And again, as you're comfortable.
And they need to know too that your medications are life-sustaining for you, so you got to take them. And you have to take them, pretty much at the same time every day, unless it's a pump-based therapy. And those are all things that, maybe they're looking for ways to learn more about that so they can better understand what you're going through.
Thanks. I think that's really good advice. Our next question from the chat: are there any specific concerns or recommendations regarding sex? For example, is there anything that would be unsafe for a PH patient, or ways to manage symptoms?
I'll try that one, Fran.
Okay.
So what I would say is, with any exercise, how we counsel our patients is, pay attention to how you feel. So if you are really trying to do something very athletic and you're, getting short of breath and starting to feel lightheaded, well, then that's too much. And also, like Fran mentioned, you need to kind of pick the time of day where you have the most energy, and try to kind of negotiate that with your partner. But just as I said, like regular activity, you need to pay attention. And there's going to be some days when you have more, kind of stamina, and maybe some days when you have less stamina. So just take care of yourself. That's why Fran and I wanted to do this webinar, because we really want to support you all and help you, with living with this disease.
Yeah, that's so true, because sexuality is very much a part of who we all are, and that can't go away because you have PH. So all the things we mentioned, just take them into consideration, and again, do try to incorporate it into part of the day where you have most of your energy. And some days maybe that's not going to happen, but once you get used to it, most days it can, I'm sure.
And the other thing is to have a little bit of humor too. I think that's really important. Fran mentioned having like a little specific term between you and your partner when, like, okay, maybe this is getting to be too much, or maybe like, hey, let's have some fun together. So add some humor to it. It's really like quality of life here.
Great, thank you for answering that. The next question we have, sort of similar to the relationship question, what do you think the easiest way as a newly diagnosed patient would be to explain what I have to others?
Very simply, I would say, to start out that it's, high blood pressure in the lungs, and the lungs and the heart work together, and the heart at times is going to be more strained and, can result with fatigue and shortness of breath. I also think that whoever the physician and nurse team that this person that asked the question is seeing, I think they can also direct you to materials. The survivor guide, has a lot of basic explanations to explain that may be helpful. Any other resources you can think of, Fran?
I think that PHA, I always tell my patients to go back to PHA because I think that I'm still astounded at how much information they have available. And I know I've probably just touched the tip of the iceberg. But I think, too, and I think, Chris, you mentioned this before, if you want to bring that special person in your life to your office visit, and it may not, you may not be married, maybe it's not your husband or your wife, bring them. Because we could certainly sit down and have a conversation as your PH providers to help them understand the situation better. And I think, too, if you take your medications religiously, you're going to feel better. So they need to understand that this isn't. We've come so far in this disease process. So you'll be getting stronger and have more energy as time goes on. But bring them to an office visit. I think we would, and I know I speak for Chris too. We'd be happy to share information that we have, and maybe helping them understand a little bit better of what's happening as far as the pathophysiology goes, but also how that translates to you in your everyday life.
And I think the knowledge and the education will do a lot. Maybe they're frightened and they don't want to tell you. They're afraid to say that. So I think getting the education and hearing from the doctor and the nurse, what it is about and what is realistic with respect to symptoms, et cetera, would be helpful.
Thank you. Our next question, I'm expecting to enter menopause in the next few years. Should I expect any different symptoms of either menopause or my pH, and is there anything I need to do differently to manage my pH during menopause?
I'll start on this one. I think you need to, knowledge is power, so get to know as much as you can about the menopausal process. I think for the most part, you're going to go through what every woman goes through, because those decreased hormones can make your vaginal tissues drier and thinner, so sex may be uncomfortable for you. Decreased hormones, and this is all from a relationship standpoint, may reduce your sex drive. Night sweats may occur, and if you don't sleep, you feel tired, and also emotional changes. So you may be emotional changes related to menopause, but also emotional changes just because of what you're dealing with your disease process. So I think if any of those escalate to a really significant level that you feel you can't handle them, what's really the underlying thing here to make sure your overall health is in the best shape it can be, and that certainly includes your where you are with managing your pH. So if you think you're at a point where any of those escalate, you should talk to your PH physician and certainly your gynecologist.
Thank you. Next question. My 14-year-old son was with me when I first passed out, which led to my diagnosis. He now has anxiety about me doing anything. How can I help him relax?
I can do this one, Fran.
Okay.
So I think it's important that the 14-year-old, kind of goes to the doctor's appointment and kind of sees that that this patient is doing better. I mean, we know that patients can have episodes of syncope, which are frightening. They're frightening to see that, and so I think he needs to know that there's a doctor and a nurse watching over his mother, and that this can happen, but they're going to take good care of her, and it's just very helpful, that he gets to know that there's help available, and then also I think if there's a support group in your area, that would be helpful maybe to bring him and see that there's other people with this disease that are living. And again, I'm sure PHA has resources, to help with children understanding a little bit better about the disease, kind of at their level. But I think he needs to feel more secure to know that mom is being taken care of.
And I think, too, I just saw this on the national news not too long ago, that there are camps in the summer for children and adolescents who are not only dealing with the death of a parent, but with parents with chronic illness. And I think they're free, actually. Some of the, I think one of the former Philadelphia Philly has an organization that does just this. So I think PHA could help you with that, because then they're kind of in their own element when they're dealing with it. They're with other kids that are kind of living through it themselves. I thought that was a great idea. So not just kids that lost parents, but kids that are dealing with parents with chronic illnesses.
Sounds like a great resource. If anybody is interested in that, we can definitely look into that and try and get you in touch with that organization. You can email us after the webinar. Our next question says, the presenters mentioned that women can experience a change in body image along with their pH. Can you talk about those changes and talk about how to improve and maintain confidence in self-image?
Sure. So I think several things. Even though you're diagnosed with PH, what about you makes you feel the best about yourself? Is it to keep your hair a certain way, to wear your makeup a certain way, to dress a certain way, things that really define you. And incorporating your disease into your life, it has to happen, unfortunately. That's what you have to do going forward. But if you still try to maintain that piece of you that defines you, and make sure that you are dressed the way you want to dress and use your makeup and do the things that make you look and feel the way you want to, I think may help. And then the other thing is knowledge is power. So know as much about your disease process as you can and what your prognosis is. Have these conversations with your PH team, what your prognosis is, what they expect for you to, where do they expect to see you in 6 months or a year based on the therapies that you're on and what might change. This way that will build confidence in you, I think. I know it would me if I had a better understanding of where I'm headed, and then you hopefully will feel better about that again. But don't lose your individual self, the things that make you you, that identify you. Your close friends should remain your close friends. I can't imagine if they're your good friends they would ever go away. Do the things that you like to do. And if you're tired, you don't do it on that particular day. But try to accentuate the things that really make you who you are, and it makes you feel better about yourself. Whatever that is, if you play an instrument, if you like to volunteer, whatever it is that makes you feel better about yourself. What would you say, Chris?
I agree with that. You are not the disease itself. You're a special person, and it's so important to take time for yourself. And as Fran said, you fit in the care that you need into your life, but remember, you still may be a mother, a sister, a friend, a coworker, and you want to keep those relationships. The one that just kind of pops in my head, and that you've seen her a lot on TV, is Robin Roberts had her episode with needing chemo and a type of cancer. And, you remember she lost her hair, and she's in front of the public all the time. And, she wore a wig, and she still came with her makeup on. And then over time she got more confident and even went without the wig. And she still was beautiful. And I don't think anybody looked at her and thought about that cancer diagnosis. You looked at her and thought, wow, she's really strong. So I give her credit for inspiring other women. It's just a great example.
That is a great example.
Mm-hmm.
I think we have time for one more question today. Is there a relationship between birth control and chronic thromboembolic pulmonary hypertension?
No, I would say not typically, but sometimes patients on oral contraceptives can develop clots. So this is something that would be discussed if this is the right type of pregnancy prevention for you. It needs to be discussed with your physician. It's not a cause of the chronic thromboembolic disease, though.
Yeah, I would agree with Chris. And sometimes other things happen when women are on oral contraceptives. They are on oral contraceptives, and they end up being immobile for a long period of time. Their plane didn't take off, and they have to sit forever on a tarmac waiting to take off, and then they're on a long flight across the United States. And so that immobility that's what we call a provoked PE, or pulmonary embolus. That's actually caused it, but the fact that they were on birth control at the time, it's a sidebar, but the immobility is really what caused, would have caused that.
People have types of factors in their blood that maybe make them more at risk for developing clots. So there's a whole bunch of reasons why people develop the chronic thromboembolic. It's not just from taking oral birth control pills.
One of the things you should never do is take oral contraceptives and smoke, because that's a really bad combination. So that's something that those two things should have a big circle with a big slash over it. Shouldn't be on oral contraceptives and smoke.
Wonderful. Well, thank you for that. I think we're about out of time for today, so I'd like to thank Chris and Fran again for leading this conversation. And, of course, thank you to all of you for attending the webinar today. I hope you found the conversation to be valuable and that it's helpful in your life. So when you exit the webinar, please also be sure to fill out the survey that pops up on your web browser as you leave the presentation. We, of course, value your feedback, and we'll use it to shape future programs. If you would like to browse PHA's resources online in the meantime, please visit www.phaclassroom.org. And I hope you all have a great rest of your day. Thank you.
Thank you all so much. We really appreciate it. Take care. Happy holidays.